Multiple sclerosis pain only gets talked about, but so much. But once it gets going, woo, child, it's hard to shut it up. Straight up and down, nearly 2/3 of people living with multiple sclerosis live with pain every single day. So what does this pain feel like? A little bit of burning and buzzing, and aching, stabbing, electrical shocks. It steals your sleep, it steals your focus, and it wrecks your plans. There are 3 types to know about. First up, neuropathic pain. The burning and the tingling and the stabs and zaps. You know, the MS hug, that crush, tightening feeling across your chest? Yeah, that. And electrical shocks shooting down your spine when you move your neck? That's Lhermitte sign. Yeah, it's neuropathic too. And you know that facial pain that feels like lightning is coming out of your eyeballs and your cheeks? That trigeminal neuralgia? But wait, there's more! The second type of pain is musculoskeletal pain. So MS weakens your muscles and your body compensates. Poor posture, overworked joints, constant soreness. You know that disappointed soccer fan meme with his hands on his hips? Yeah, he's how you feel with this type of pain. And last and certainly not least, the third type of pain, paroxysmal. That hit and run jam, sudden, sharp, and then gone as if it didn't happen in the first place. On the script tip, some of the things that take the edge off of neuropathic pain are gabapentin and pregabalin. They are a literal chill pill, and they calm down overactive nerves. And certain antidepressants block pain signals. Personally, I was on Wellbutrin for a while. And yeah, things still hurt, but I just cared about it less. Do remember, each of these remedies have their own learning curve to see if it works best for you. And some might even trigger other symptoms, he said, knowing about it firsthand. And then you're on the autoimmune relief whack-a-mole. Because you took this one thing to stop this one pain, but now you have another pain, and so you take something else for that, and etc., etc. The key is finding the right treatment to treat your specific type of pain. Next up, for musculoskeletal pain, NSAIDs and muscle relaxants for immediate relief, and physical therapy to realign your body. Ice, heat, stretching, massage, all gentle yet effective. Do remember, pain isn't just physical. How your brain processes that pain signal actually matters. Mindfulness works. It doesn't stop the pain, but it shifts your experience of it. And last but not least, perhaps the most powerful pain treatment of all, the community. My MS friends on group texts, and a patient group I kick it with virtually. We meet every couple weeks. And the people I vibe with in the comments on these videos, it's straight up medicine. Look, there's no magic pill, no one-size-fits-all solution, but the path forward out of the pain starts with understanding it. First, identify the type of pain that you're dealing with. Next, work with your medical team to find out what works. Third, and most importantly, don't give up if the first couple of treatments don't really work like you like. If you deal with MS pain too, talk about it in the comments. Share what's worked for you or what hasn't worked. Because somebody somewhere in these comments needs to hear your story.